Hello everyone, I'm Jingli from West China Hospital of Sichuan University in China. Today I'm honored to present our finding on the association between adverse childhood appearance and sexual transmitted information among sexual minorities in China, evident from the trial cohort. We declare that we have no conflict of interest. Adverse childhood experience or ACEs encompass a range of severe stressors experienced in earlier life, including abuse, neglect, and household dysfunction. Globally, an estimated about 60% of individuals have experienced at least one ACEs. Extensive research have linked the ACEs to a variety of mental and physical health issues later in life. Notably, there is a correlation between childhood abuse and increased HIV risk behaviors among sexual minorities. It's estimated that there are about 14 to 30 million sexual minority individuals in China. Given the high heterogeneity within the sexual minority population, it's crucial to understand the distinct exposure pattern of ACEs across different sexual minority groups. This is lesbian, gay, bisexual, transgender, and other sexual minorities, to inform tailored psychological support strategies. Importantly, understanding the association between ACEs and STS may add value to the literature on the social psychological determinants of STS. However, to our knowledge, few studies have aimed to assess the association between ACEs and STS in sexual minorities, particularly in non-Western settings. Based on this, in our study, we aimed to investigate the prevalence, co-occurrence, and potential patterns of ACEs among sexual minorities in China. To evaluate the association between ACEs and the risk of STS, to explore the mediating role of multiple social factors. This study is based on the trial cohort. The full name is Transformative Research for Equality and Social Determinants Uplifting Resilience and Empowerment in LGBT Health. It's an ongoing population-based prospective study launched on August 2023. The trial cohort is initiated and organized through a collaborative effect involving West China Hospital of Sichuan University, the School of Public Health of Nanjing Medical University, and a sexual minority community lead organization, Chengdu Tongle Health Counseling Service Center. The inclusion criteria is the participant self-identified as LGBTQ and currently resided in Chengdu. And if the people younger than 16 years old or cisgender heterosexual will be excluded. And the participants were recruited through on-site activities, social network, and post on official WeChat account of Chengdu Tongle. To ensure the quality of the data collected, we implement several measures, including payload testing and attention checks and logical consistency verification. The assays were measured using a validated 10-item assay score, and the outcome in our study include HIV infection, which means the participant has been diagnosed with HIV infection or AIDS. And other STS, it means the participants have been diagnosed with STS except HIV infection or AIDS. The statistic analysis in our study, including descriptive statistics, cluster analysis, logistical regression, dose-response relationship, and mediation model. All the analysis conducted using 10,305 people registered in the trial cohort between August 2023 and March 2025. And finally, we involved 8,384 individuals in this study based on the inclusion and exclusion criteria and the rule of data quality control. The median of the study participants were 26 years old, and we found there are 36% people report have no any access. And the participants with higher level of access were more likely to report smoking, alcohol, substance use, and PTSD, no other STS. And among all the participants, there was 33% report exposure at least one ISIS. And among the ISIS, the emotional abuse and physical abuse was the most frequently reported. And across the LGBTQ subgroup, the transgender participants consistently reporting the highest exposure risk. And among those people who reported any ISIS, we found there were 80% reported 2 or more. So we further to explore the potential pattern of the ISIS and find there 4 pattern which namely by the severity the most affected and the predominated by emotional and physical abuse, predominated by household violence, and the least affected. The associated analysis, we find the exposed to any ISIS were significantly associated with the risk of HIV infection and other states. Individuals who experienced a greater number of ISIS appeared to have an increase of other STS in a dose response manner. And the most affected ISIS pattern correlate with the highest risk of both HIV infection and other STS. And among the single ISIS exposure, we find the physical abuse, sexual assault, household violence, and parental separation or divorce were associated with the HIV infection, especially among the male. And all the ISIS were associated with the risk of STS. And the risk estimated of other STS were generally comparable across LGBTQ subgroups. Mediation analysis revalidated that lifestyle behavior, especially substance use, accounts the largest proportion of ISIS link, followed by psychological factors, while the socio-economic studies have no significant mediating effect. In conclusion, acids were highly prevalent among sexual minorities in China, with transgender individuals report the most intensive exposure. Each type and any number of occurrences and various patterns of acids were associated with the higher risk of other states. Some special acids were associated with a higher risk of HIV infection. And finally, the mediation analysis highlights the lifestyle behavior and psychological factors as a potential target for intervention. We acknowledge all participants and data collectors of the trial cohort and the support of Professor Huan Song and Professor Dan Wu. Thank you for your attention.
Yeah.